So I think we figured maybe we'll just kind of dive into some of the questions that we had posed,
Mhm,
um, and kind of see where the conversation takes us.
mhm.
We can follow the questions. We can go as much off script as we want to. And then if you have questions for us too, I mean, please feel free to, we'll just, I think, all sort of have our spirit of curiosity and generosity throughout the conversation
Sounds
um,
sounds great.
and go where we go.
Sounds
Um, so to kind of kick us off, it's really, you know, sort of why are we here
mhm.
and having this conversation today, right? As we're looking at a world that has more stress, increased rates of burnout. I mean, we see it in every, you open any news media and it is now part of the daily commentary and conversation. Um, you know, why are we here and talking about this, and why is it such an issue now?
Mhm. Yeah, it is absolutely a moment, right? I had the experience of about less than 10 years ago being invited to give a talk for a large multinational corporation about mental health, but I was asked not to use the term mental health or mental illness because they would be too triggering, they would be too provocative, they're too pathologizing, and I should talk about coping and resilience and well-being. And just recently, within the last 6 months, went back to the offices of this bank, and the individual who had invited me 9 years ago now has on her door, "Want to talk? I'm a mental health ambassador." Right? So, I mean, the world has changed, just to your point. The conversation has really shifted and people are really talking about mental health. And I think there are a number of reasons why, and I'd be curious to know your thoughts on this, but clearly the issues were real before the pandemic, and there was growing awareness around mental health and the cost of not addressing mental health concerns. But the pandemic was the force that broke the dam, and it has come spilling out and spilling over, that if we don't pay attention, it doesn't go away, the pressure just builds up. And so with COVID, the issues have come to the fore in terms of the pressures on people due to increasing expectations around productivity, issues around staffing, issues around technology and the blurring of boundaries between home and work, and the generational shifts that the young professionals have grown up with, a message of bringing mental health issues to the fore and making mental health part of the story around health. And they are now in the workforce, and their expectations are that mental health is part of the story. So I think there are a number of factors that have contributed.
Mhm. And with the increased stress and rates of burnout, I'm curious to get, so if we could dive a little bit deeper into what you just shared, what are the impacts on individuals and organizations?
So what we're seeing is that in the surveys that have been done during the pandemic and now, I mean, we're still in the pandemic, but in the different stages of the pandemic and continuing to endure, even in work contexts that have returned to a in-person engagement after work from home, for example. We're seeing that about, and estimates are, and again, this is before the pandemic, right? So, but surveys of workforce indicate that about 15% of working adults have a mental health condition. So in any workplace, you've got workers, 15% of the workforce is managing some kind of mental health condition. And then if you think about that, given the prevalence of mental health issues, if it's not the worker themselves, with 1 in 4 people having a mental health condition, it's a parent or it's a child or it's a loved one, right? So it's absolutely top of mind for people. The increased stress related to the uncertainties around the pandemic, and I would say also, depending on where people live, the accelerating conversation around climate and the in certain contexts, certainly in the United States, the political stresses and divides have put enormous pressures on people, and it's impacting the workforce in terms of capacity to focus, capacity to tolerate the stress, and essentially at a certain point, people are highly resilient, but everyone gets fatigued, right? So it's the cumulative stress is really a huge burden. We have about 59%, right? So about 60% of workers report that their mental health is negatively impacted by their workforce, based on a study that reports from data from the World Health Organization from just a year ago. So that's a really high percent. So you've got this very high percent of just baseline mental health conditions. Then you've got the cumulative stress of our times. And I would say the good news is that the vast majority of workers also believe that their organizations and leadership within their organization can take actions that would positively impact their mental health. So there's a need and there's a huge opportunity.
Yeah, it's interesting because and I'm curious to know, I think, a little bit more about the data as well. But when we think about those statistics that you just shared, around 60% of people feeling a negative impact, and so many people struggling with mental health issues, whether they're the actual individuals or the folks that surround them in life. We do a lot of work thinking about what are people's sort of survive and thrive states. How are we absorbing all of the inputs around us, and how are those different experiences and perceptions triggering either those survive responses or that thrive responses, so that sense of possibility. So I was struck by that contrast between how we experience work, but then also what we believe is possible, sort of as a collective. Because that's a really powerful, I think, just piece of awareness for us to be able to have about ourselves individually, about what signals are we putting out, and then how are we responding to the signals that we're receiving, and how that can have just sort of the heightened awareness around that can have such an immediate impact on how we show up. I'm curious to hear, just particularly of the past couple of years as we've been going through the pandemic, if there, in all of the research that you've been part of or that you've studied, is there anything that's sort of come out that has been particularly surprising or particularly or exceptionally concerning that we need to, as organizations, really be putting front and center as something that we need to address with a sense of urgency around it?
Well, one of the priorities that we've identified is that now that leadership, organizational leadership, is recognizing the ways in which mental health is part of the story of health and part of the workplace and workplace culture, the need for guidance on how to effectively make change. What are the things that really matter? And what can leaders do that will have the greatest impact in terms of supporting their workforce? And I think this is a really, really serious issue. And it's serious on multiple levels, because for forever within the world of mental health, we've been advocating for people to pay attention, right? And now we have the attention of organizational leaders, and we've got to get it right, right? We can't swing at this one and strike out. And so the risk of whiffing here is that we're going to lose the newfound allies and ambassadors and individuals who can really have enormous impact, because we know that there are things that do make a difference in terms of addressing mental health. So the risk of the lack of guidance for leaders is a huge issue in our assessment. And what we're seeing is that there are many, many programs and companies and solutions out there that actually may be very effective, but in many cases are lacking data. And there's also a significant issue that for organizations new to mental health, they're not really, oftentimes organizational leaders are not really sure what problem they're solving for, right? Mental health is a big concept. And so getting clarity for organizational leaders to get clarity about what problem they're solving for within their organization is really critical, because until that is defined, knowing which intervention or what strategy is going to have impact is impossible. And so a major effort from our center, and in partnership with One Mind at Work and with Ethisphere, we've set up a partnership team to build out a mental health at work index to help organizational leaders, in fact, assess their programs and services and define the problems that they need to address, want to address, and assist in developing strategy. I think that level of measurement and clarity is really, really key right now.
That's very interesting. And I want to stick with this notion around what you just said about needing to get it right. So we have the attention of people, of many, many people, that this is a very important issue. We need to get it right. What happens, what happens if we don't deal with these issues now in the right way? And we just sort of move on from the recognition phase to going on business as usual.
Mm-hmm. Right. So if we don't get clarity about what problem we're solving for, and we don't look to the science, and where science is lacking, at least engage based on science-informed strategies and measure what we're doing, we're going to wind up with organizations that are going to spend resources. They're going to spend time, they're going to spend money, they're going to spend bandwidth and creative energy on something that doesn't have impact. And that then is going to have the impact of reinforcing the myth, and it's absolutely a myth, that you can't address mental health issues. There's nothing you can do. But there's nothing you can do if you have a total mismatch, right? So in any health condition, right, if you don't know what the condition is, then you don't know what the intervention should be. So that's a big problem. Then, or a big risk, I should say. And then if organizations go on and just say, this will pass, this is a product of the pandemic, and we're just going to put our heads down and go back to business as usual, the huge risk for an organization, I think they are writing their obituary, because we have clear evidence. We have data that is very consistent around the upcoming generations of professionals, and expectations are that health includes mental health, and expectations are that mental health will be part of the integrated story of what my workplace is. And that includes an expectation around organizational culture. It includes an expectation around access to mental health services and supports. It includes a resetting of culture around boundaries in terms of private life or weekends or time off, for example. So the risk for organizations who want to sit this one out is that they really are going to lose in terms of reputation, which will have enormous impact on their capacity to recruit and retain talent. And in the market that we have today, where we have enormous labor shortages across most disciplines and industries right now, you can't afford to have a failing reputation and not be able to recruit and retain good talent.